Leslie Cartato. I'm a health and physical education teacher, an assistant softball coach at the high school level, and a former head basketball coach for 14 years.
Mark Press. I'm a speech language specialist, and I've been teaching for 16 years.
Caitlin Musso, and I'm a high school history teacher, and I coach the varsity dance team.
And my name is Jacqueline Wood. I teach physical education and health. I also coach 3 sports, soccer, basketball, and softball at the high school and middle school level. I've been teaching and coaching for 4 years.
Prior to the injury, well, as a physical education teacher, very active. I don't like to stand around. I like to be moving in class. Sometimes I get involved in the game or the activity my kids are doing. I go to the gym 5-6 days a week, cardio, lifting. I like to ride my mountain bike. I like to walk, run, walk my dogs. So I was very active prior to my injury.
Okay, I'm going to put it out there. I'm not the most active person in the world. I do little interval running, walking. My passion is I have a 1980 MGB, which is a British sports car, and I restore that. And I attempt to play golf.
I was pretty active. As a teacher, we're up all the time. We teach at least 5 classes a day. After school, I coach the dance team 2 to 3 times a week from October through March, and I also am pretty physically active as I go to the gym 4 to 5 times a week.
I've always been a very active person. I played soccer my whole life. I played soccer at the college level. So teaching phys ed, I'm a huge part of the class. I get involved in a lot of the activities with my students. On the practice field as well. I'm also a big runner. A week before I got injured, every year I run the Spring Lake 5 with my dad. So whether running or playing with my students, working out in the gym, I was a very, very active person.
I ruptured my right Achilles playing pickup basketball against some of my players, my softball players, with my head coach and my assistant coach, 3-on-3 basketball. When I got hurt, the night I got hurt and I knew I needed surgery and a long road of physical therapy ahead of me, I immediately, the first person I thought to contact was Nicole. She was my former student and one of my former basketball players. Excellent athlete, excellent student, one of the hardest working young ladies I had ever worked with. And so I knew in order to get back, that would be the person I needed to go to. And she was amazing. Literally, I felt like a shell of myself, and she just was encouraging, professional, knowledgeable, and it was a big role reversal. She coached me and helped me just like I used to do for her. I wouldn't have gotten this far or gotten to the point I am at now if it wasn't for her. From the front desk to Nicole, from the minute I walked in, reassured me everything would be all right, and by the time I would be done with physical therapy, I'd be back to the person I was. And I did. I got back to who I am, and they helped me with my confidence, physically got me back to where I need to be.
First, I was there for back herniated discs. Then I was treated for plantar fasciitis. Then I was treated for both hips. I had surgery on the hips. That was the first surgery, and that was I had torn labrums. My experience was exceptional. I mean, I'm always gushing about Excel. You walk in, and not just your therapist knows you, but everybody knows you. It's like, "Hi Mark, how you doing?" And it's such a pickup. And when I was in for back, I was in a lot of pain. I was getting kind of depressed about it. I had a bad day at work, at school, and yes, teachers do have bad days. Going there just lifted me, and it was fantastic. I got scolded too for spending too much time there, as a matter of fact. So.
I was a competitive dancer for 15 years, and when I was in high school, I fractured my right kneecap. I rebounded quite quickly. I was on crutches for maybe 2 weeks, and I was back to dance without physical therapy. But it caught up to me 10 years later. I'm in my 20s and I have stage 2 arthritis. So that's when I got an MRI and started going to Excel. I've had a few injuries in my past, and I've always quit physical therapy. I always just went maybe for a week, 1 or 2 times, and I was done. So when I started Excel, I'm like, I'm probably not gonna follow through with this. But once I walked through his doors and I had Jason as my physical therapist, I'm still going there. I've been going there for about over 2 months now, and I love it. Every time I go, they're so welcoming, they're so attentive. My next workout is set up for me before I'm even finished with my first one. They're really well prepared, and they always have smiles on their faces. As soon as I realized that I have arthritis, I had to stop working out. I couldn't wear my heels anymore, and I couldn't really stand while teaching. Now I'm able to stand for hours on end. I can go back to my heels, and I'm going back to working out 4 to 5 times a week as well.
Playing soccer, I tore my ACL, MCL, meniscus in my left knee. I needed surgery, but before surgery, my surgeon told me I needed 3 weeks of prehab prior to surgery, at least 6 months of rehab afterwards. A family friend from town recommended Brian in the old Japan office, and that's when I started with Excel. So this is the first time I ever needed surgery, so when I walked in and I knew the whole process was going to be a while and difficult, I was really nervous. I know a lot of injuries that happen to athletes, and Brian he really cared. I got really excited during prehab because I felt like I didn't even need surgery, and that's when they said, "You're ready for it." And with the help of Excel and Brian and their whole staff here, I'm still using the crutches, but I could almost walk without them, and I couldn't be happier with my experience.
I would absolutely recommend Excel for anyone that needs physical therapy services.
If I knew anyone who needed physical therapy or services of a physical therapist, the first place I would recommend would be Excel Physical Therapy for what they did for me.